Y'all ready for today's topic?
Here I am.
Yep.
Oh, I just realized the nails are pink too.
Oh, nice.
Okay,
Look
get it,
at
girl.
that.
Yeah.
Get it, girl. All righty. So today we are talking about breast cancer awareness, which is why we all are wearing pink because we want to represent Breast Cancer Awareness Month for October.
Can you see my? Yeah, there you go.
Yep, there we go. The breast cancer ribbons. There we go. There we go. I wanted to do this topic on breast cancer awareness due to my experience with breast cancer, being diagnosed with breast cancer at the age of 41, going through treatment and all that it involves, chemotherapy, surgeries, and all of that good stuff. So for the month of October, since my diagnosis, I have been doing whatever I can as far as representing breast cancer and awareness, because it is important and it has impacted my life tremendously. So that is why I wanted to focus on breast cancer awareness in the month of October, wear out paint, and just have a conversation about things we can do as Black women and women in general moving forward and educating people. So I wanted to start off with reading out a few statistics, and I want you ladies to tell me if it is true or false. The first one, Breast Cancer Awareness Month started in the United States in 1996.
I didn't know it was gonna be this kind of this kind of question because I absolutely do not know the answer to that. I'll take a guess of true.
Okay. Miss Moore. Don't be Googling
You're
it.
right.
You
You're
cannot
trying
be
to Google
Googling this because it looks like you are cheating. So what are your thoughts?
I'll say false.
Okay. So Breast Cancer Awareness Month in the United States began in October of 1985, which is crazy
Way crazy.
because when you think about Breast Cancer Awareness Month, like, it wasn't anything that I was aware of until being diagnosed with breast cancer. Like, I always saw people like participating in breast cancer awareness walks and everything like that. But when it's not affecting you, it's just something that you don't even pay attention to. So it's crazy to know that 1985 was when breast cancer awareness started. And they are celebrating the 40th anniversary of breast cancer awareness this year. So
Nice.
good to know.
Wow.
All right. Next one. 65% of women diagnosed with breast cancer have no family history.
Hmm.
Okay.
Yeah, I'm gonna say true as well.
All right. So 85% of women diagnosed with breast cancer have no family history of breast cancer.
Wow.
85%.
85%,
Wow.
which is crazy. Next one. 1 in 5 women in the United States will develop breast cancer in their lifetime.
False.
Look,
I think it's
Oh.
4.
At this point, I feel like it's more than 1 in 5.
It's actually 1 in 8 women in the United States
good.
will develop breast
Yeah,
cancer in their lifetime.
that's less. Okay.
All right. Only women get breast cancer.
False.
Yeah, false.
Okay, yes. So there is approximately 2,800 men that are diagnosed with breast cancer each year. So even though breast cancer mostly affects women, men can also develop breast cancer, and it's important for them also to examine their chest wall for lumps and things like that, because it doesn't exclude them because they don't technically have breasts. So all right, let's see. Black women and white women experience death from breast cancer at the same rate, incident rate.
I'm going to say false.
False.
Okay. So, Black women are more likely to die from breast cancer despite having a lower incident rate. And it's 40% more likely than white women. So, yeah. And the last one that I'm going to do is having a mastectomy, meaning having your breast removed, eliminates the chance of breast cancer coming back.
False.
False.
Yeah.
It decreases it significantly, right? But it doesn't eliminate it.
Yeah, so that's definitely something. So you can go through treatment, you can have a mastectomy, and that doesn't mean that the risk of it coming back is gone. There's still a chance of a reoccurrence, which is why when a person is diagnosed with breast cancer, they're still monitored because the reoccurrence rate is higher the first 5 years, and then after that, then it decreases, but it still doesn't erase the possibility of a reoccurrence. All right, so that was fun. It was always like getting information on facts and myths is just mind boggling because, like I said, it's not something that you think about. It's not something that you even like pay attention to. And as women, you would think that we would be more knowledgeable about breast cancer risk and things to do to make sure that we are doing breast exams and checking ourselves. I would like to ask you guys, how often do you do breast exams?
Not as often as I should.
Okay.
So I do it at least once a month, and that's only because I found a lump while I was pregnant with my first daughter.
Mm-hmm.
And so incidents of breast cancer during pregnancy are not non-existent.
Yeah.
And yeah, so for at least the last 6 years, right? That's how old she is. I've been at
Mm-hmm.
least monthly.
Okay. And when you did find a lump, like what kind of follow up happened after finding a lump with your providers, or did you even let your doctor know?
Yeah, so I absolutely let my doctor know because it's funny, right? They teach you how to do a self exam, and the whole time, especially like as a Black woman, when we naturally have lumpier breast tissue than other people, you're checking and you're like, what am I looking for? My whole breast is lumpy. But I was able to like significantly tell the difference between what I found and everything else. And so they did an ultrasound and cleared me of any concern. It was a milk duct.
Mm-hmm.
But I did immediately let my doctor know. And so I had to follow up with a breast surgeon who did more exams. And I for some time, and she's like, I mean, there's nothing to be concerned about, but if it starts to bother you, then we can remove it.
Mm-hmm.
Yeah, so that was, I did ultrasound, and then I went to a breast surgeon.
Okay. Yeah. Are you required to get mammograms right now?
No, not
Like in
yet.
Okay. All right. And that wasn't a recommendation just because they figured it was because of your pregnancy that you had issues with the milk duct.
Yeah, and it's interesting, right? Because so it was the, you don't have any first degree family history. And we're pretty certain, based on how it feels, the size, that there's nothing more that you need to do. So I was on a follow up regimen for some
Mm-hmm.
time. And then, like, she discharged me from care, from her care.
Yeah. So that's interesting because I didn't regularly do breast exams. And it's like when you are seeing a doctor regularly, thankfully, because I was on birth control, I always had annual appointments for my women's exam with an OBGYN. And during those appointments, the doctor would do exams. So it was during one of those appointments where the doctor did a breast exam and she noticed that I had a lump. So she sent me for a mammogram. After the mammogram, I got called back for an ultrasound. And because I had no family history, the reports would say probably benign, to follow up every 6 months for ultrasound and mammogram, which they were going to monitor for 2 years. And to me, it was frustrating because it's just like you fill out the doctor paperwork as honestly as you can. You get a mammogram, and for whatever reason, they see something and they want you to come back to do an ultrasound. You do an ultrasound, and because they look at your family history, they're like, it's probably benign. So just come back in 6 months. And I'm just like, probably, but benign doesn't make me feel good. Like, is it
Right.
benign or is it not? Like a positive probability don't work well for with me if it's not
Yeah.
100% probability that it's not an issue.
And not to mention the statistic is that 85% of women don't have a family history, so that those don't go together.
You think it's the opposite, where if there is a family history, then it's more of a concern. So a lot of times doctors will look at your paperwork and be like, well, you don't have a family history, you're young, you're healthy, so it's not anything to worry about. Continue to do breast exams. If you find another lump, then we'll take it from there. So after the first mammogram and ultrasound with the report of it saying probably benign, I followed up in 6 months, but I went to a different place to get the mammogram done because it's just like it didn't sit well with me with the answer that I got. So went to the other provider and it was the same thing. They look at your forms that you fill out, your history, family history, and the report was the same. Probably benign. They compared it to the other ones. There wasn't any changes in the lump or anything like that. So it's just like, I guess it's nothing I can do. Like, I got a second opinion from somewhere else. Insurance is crappy. So you can't just keep going places to kind of see if there's a different answer. So it was just a matter of monitoring every 6 months. So fast forward about a year and a half, 2 years after the every 6 months of getting the ultrasound and the mammogram, I noticed that I had another lump in my breast. And when I called the doctor to let the doctor know, it wasn't like they rushed me in like it was urgent. They're like, okay. I called in December. They're like, okay, you're due for your women's exam in January. So we'll schedule you to come in January to do your women's exam and we'll check your breast as well. So fast forward to January, that's what they did. It was another lump. So I got sent back to get another mammogram and ultrasound. And after that, I had a biopsy, and from January to February, the biopsy report came back, and it turned out that it was cancer. So that journey for me was a difficult journey because it's just like I felt like, well, maybe I shouldn't have been honest on these forms. Like, I want to be as honest and forthcoming with information so that the doctors can know what they need to know about family history, my health history, and things like that. But it feels like as soon as you indicate no one in your family has breast cancer, then it's just like, it's probably nothing. You're young. Like I said, they look at all of the risk factors and they kind of ignore the concerns that you have. If you're not an advocate for yourself, like, do you just let it go and hope that the doctor knows what they're talking about? Or do you feel relieved that, oh, it's probably nothing, and then you listen to what the doctor's telling you, you don't do nothing else about it? When you think about breast cancer, being aware and knowing that just because the doctor says something doesn't mean that you can just take that information and just accept it at face value.
Yeah, it's really bizarre to me because at some point in the family history, someone was the first person. And so,
Exactly.
do we just
Mm-hmm.
assume that the first person is always before whoever's in front of you?
Right.
Mm-hmm.
It makes sense that the percentage of Black women who die from breast cancer is as high as it is because there's
Mm-hmm.
probably lots of it's not, it's nothing, I'm sure it's nothing, and people get so, uneasy and anxious about what it could be, that when they're told it's nothing, I think you're right, Isha, they're just like, okay,
Mhm.
it's probably nothing.
Yeah.
Mm-hmm.
Yeah. So yeah, that's true. And after the diagnosis and going through the treatments, like my breast specialist ordered the genetics testing, and come to find out I have a genetic disposition that puts me at higher risk for breast cancer and ovarian cancer. And my mom also did the genetics testing because it comes from either your mom or your dad. My mom tested negative for that genetic disposition, which means it's from my dad's side. And men are not affected by this genetic disposition. So my dad only has brothers. So there may not be anyone that has it because it's all men and they're not affected. One of the things that I always think about since going through what I went through is my grandmother, my dad's mom. So she passed away. She was older. She passed away from brain cancer. And I just wonder, with her being an older female, knowing that breast cancer metastasized, like, could that have been something that was undetected and then it spread? Because again, the genetic disposition is from our dad's side, and our grandmother did pass away from a cancer. So it's just like something that we won't ever know, but it's a possibility. Like, if it was undetected and it just spread to where it got to that point where it showed up and it was automatic, oh, she has brain cancer.
Yeah,
Yeah.
because that was where it was the most noticeable.
Yeah.
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 It's very interesting. I know a few people, actually, my aunt passed away a couple of years ago, and hers had metastasized to her brain as well. And my sister has a very close friend who had breast cancer.
Mm-hmm.
It metastasized as well. And it's interesting, like the linkage between the different cancers in like different parts of your body, specifically
Mm-hmm.
breast cancer, because there's some people who it
Mm-hmm.
goes to ovarian, and others it, instead of like going down, it goes up. And it's just interesting, very, very interesting.
Yeah. Yep. And that's the thing, like, being that I have been diagnosed with breast cancer, like, if it was to come back and if it was to go somewhere else, it would still be considered breast cancer that metastasized. But if you don't have that diagnosis originally, then wherever they find it, they're going to assume, okay, it's brain cancer or it's this
Mhm.
cancer, and not realizing where it started and the, like, progression.
Mhm.
So, yeah. So, Dika, you recently got the genetics testing because, as a sibling of mine, it was recommended to have the siblings' parents tested. We also had our children tested, even though they stated that our kids are young, and if they are positive for this genetic disposition, there's not much we can do at this point. But we still decided to have it done because it's just like, it's better to have all of the information that you need. So as they get older and grow up, we have that information to provide to doctors, and then insurance is covering it. So let's just reap the benefit of getting the information we need that will benefit our children down the line. But with your genetics testing, like, how was that getting your results and the results for your kids?
Um, well, I was I had mixed feelings about it. Like, not even mixed feelings. I was kind of just in shock. All of my children were negative, which was great, so they don't have to worry about that. But mine's was positive for the same genetic makeup like you. So now it's just a whole bunch of things that I have to think about future wise. I now have to get mammogram and MRI every 6 months just for monitoring. And because that specific gene is also higher risk in ovarian cancer, now I have to also think about if I want to have that procedure done to have my ovaries and fallopian tubes removed. So it's just been a roller coaster of emotions. And so one day it's like, oh, well, I'd rather just get the surgery done so I don't have to think about it. And then other times it's just like, I don't want to get it done. Maybe I could just watch it closely and monitor. But the thing about ovarian cancer is that there's no way to detect it until you have it. And so, so that's my back and forth. And like I said, it's like one day is like, well, I'd rather just get it done so I don't have to deal with treatment of cancer. And then other days it's like, I don't want to do it. I don't, because of all of the possible side effects that come with that. And so, that's pretty much where I'm at now. So just getting monitored. I actually have to have my first MRI next week. So, yeah.
So they're recommending that you have the breast MRI. So it's not just the mammogram and an ultrasound. They're going to actually do a breast MRI.
Yes.
Yeah. Okay. Which is good. So there are different things that procedures that are done for monitoring a person's breast. So it's not recommended for a mammogram until you're 40. So if you don't have any lumps or any concerns with your breast, insurance is not going to even pay for you to have a mammogram before the age of 40. So once you reach the age of 40, insurance pays for a mammogram. If there are concerns with the mammogram, the doctor may recommend the ultrasound. And the unfortunate part is women that have dense breast tissue may have cancerous tumors that isn't easily identified through a mammogram and an ultrasound. So they are trying to work on passing legislation that will also allow women with dense breast tissue to also have a breast MRI, because that will allow any type of cancerous tumors to be visible. But it's still not something that's in legislation now. So again, it goes back to advocating for yourself, making sure your concerns are being addressed by the doctors. And if your doctor is not taking your concerns seriously, I always recommend going to see another doctor. So we have a cousin, I'm not going to mention her name because of confidentiality. I work in a job where HIPAA is important, even though this is not a client. But a family member that's also on our dad's side of the family, which means, okay, we already identified this gene is prevalent on our dad's side of the family. So my cousin, her dad and my dad are brothers, and she's had issues with lumps in her breast. She's had a mammogram and an ultrasound and biopsy done at one point because she did have multiple lumps that were painful. The biopsy came back negative, and then there was no follow-up. Years, nothing, no recommendation. And I'm just like, that's crazy to me, because even though with the biopsy it may show that it's negative, that shouldn't mean you no longer have to get monitored. There should have been some type of protocol in place. So after having a conversation with her, after my diagnosis and everything like that, we've been talking, she found another doctor. The doctor is actually monitoring her every 6 months and making sure she's connected with the providers that she needs to be connected to, so that there's ongoing monitoring. And her doctor even did the genetics testing, because our testing came back positive for a genetic disposition. So it's just again, the medical realm of things is failing women. I don't think they do what they need to do to make sure that there's ongoing monitoring. And whether or not you had every test in the book done and it came back negative, there should still be follow-up. And there was none for a few years, which is crazy to me. And she also expressed feeling like the doctors is just blowing her off before she found a new doctor to work with. And again, I know that women may sometimes feel that way when your concerns are not being addressed, or they're making it seem like your worries for nothing. And then it's just like, then you stop feeling comfortable going to the doctor and talking to the doctor about your concerns, because it's just like they're brushing it off anyway. So
Mm-hmm. And
I
it
think
may have to do too as well with her age,
yep.
because she just recently turned 40 and
And no history.
no history. Mm-hmm.
Again, crazy. Craziness. So Lauren, you mentioned that you started doing breast exams 6 years ago when you were pregnant with your first child. So prior to that, was that even in your radar or something you felt you needed to do?
So it was. Just because my family on my mother's side has a history of dense breast tissue. Right? And she'll be like, girl, you always telling my business. So my mom and I have at least one cousin who both had to have cysts removed. So it's always been a thing, just like, diabetes from my father's side, that my parents have always had us monitor. But I feel like as I got older and my breasts got bigger, I got more confused about what I was looking for.
Yeah.
So I kind of would kind of do it. Okay, great. I don't feel anything different. But I was not as diligent about it as I am
Yeah.
now.
What about you, Dika?
Like I said, I don't do it nearly as much as I probably should, at least once a month. But I'll do it just randomly. Like if I'm laying down, I'll
Mhm.
be like, oh, let me check. I haven't checked in a while. But it's just it hasn't been something where I'm like, on it as a schedule type thing to keep checking. Um and I also have dense breast tissue. They say that in the mammograms all the time too.
Mhm.
My breasts are really soft, so it's pretty easy for me to
To
just
the
do
time.
it back. Yeah.
Yeah. Yeah. One story. When I was first diagnosed with breast cancer, um, my mom, shout out to you, mom,
I already know what you're gonna say.
very unfiltered. And her thing was breast cancer, your breasts are small. Like, how do you have
Yeah.
breast
Yeah.
cancer?
See, that you being filtered, because that was not what she said. What she said was, how do you have breast cancer and you don't even have no titties?
Gotta love you, mom. Gotta love you, mom. So that is another myth that women need to understand. Like, you can have itty bitty bitties, and that doesn't mean that you're not at risk of getting breast cancer. Your breast size doesn't matter. Again, men can get breast cancer and they don't even have boobs.
Mhm.
Well, some men don't. And another thing is just like to throw shade, but another thing is also like living a healthy lifestyle. I have been connected with so many people in like support groups going through the whole breast cancer journey, and it just is crazy, saddening to just see how many people from all different walks of life were in the same group going through the same thing at the same time. Like, we had people who were fitness instructors, healthy, no smoking, no drinking, no eating unhealthy foods. They're vegans and vegetarians, and like people that are doing everything in their power to be healthy, but that doesn't prevent a diagnosis. It may lower your risk, but nothing is 100%. If you do this, then you don't have to worry. Also, with a lot of young women, the amount of young people that are being diagnosed has increased. Um, and it was females early 20s going through this. And I think that was like a humbling moment for me, because it's just like when you're down and you're in the mix of what you're going through, you feel like it's the end of the world, but then you're connected with girls who are barely becoming an adult, dealing with it, worrying about treatments and if they have to have procedures, are they going to be able to have families or have kids? Like, we had some women in a group that just got married and now they dealing with like all of this, and it's just like crazy just to think about all of the myths that have you feeling like, well, I'm not old, I don't have a family history, I don't have anything to worry about, when the fact of the matter is, like, there's no one that's off the table from potentially having this diagnosis and having to go through treatments and things like that. One thing that I do want to point out is that early detection is like a big thing, which is something that would definitely decrease the amount of women who actually die from breast cancer, because they do have treatments that work. But it goes back to self exams, communicating concerns with the doctor. Like, anytime you notice something that's odd or not normal, making sure you see your doctor and communicate your concerns to the doctor, and then finding a doctor who is actually willing to listen.
One of the things I want to do is thank you for being transparent and willing to even have this conversation. I think for a lot of people, just a lack of knowledge is what actually is their major downfall. And so one of the things that I'm always hoping to encourage people to do and be a part of it is allowing for spaces like this, because you don't know what you don't know. And I would hate to even attempt to imagine how many people in that 85%, pass away simply from a lack of knowledge. And so sharing your journey and being willing to do that is super, super important, especially as the ages continue to get lower and lower. I know my mom had a bout with cancer, a different type of cancer. And for so long, she wanted it to be kept under wraps and for people to not know about it until someone 25 years old who knew that she had been diagnosed was like, I really need to speak to your mom because they want me to go through chemo and I just don't even know what to even expect. And so thank you very
Yeah,
much.
yeah, and like, that's one of the things that's like big for me. Going through what I went through is just like, is an eye opener. And I feel like I would do a disservice to anyone that's willing to listen to not share my story, because I'm sure there's a lot of women who can relate. Like, relate to going to the doctors and feeling unheard, or relate to not even doing a breast exam because you don't think that you have anything to worry about. Like, again, when you fill out your medical history, which is again important for doctors to know, but when you fill out your medical history and everything, it's like, no family history of this, no family history of that. Mostly everything in our family might be like high blood pressure, high cholesterol, diabetes, for like some people in the family, but no to breast cancer, no to this, no, like everything is no. And then the doctors give you this false sense of, okay, you're good, like you're healthy, like you have nothing to worry about. And then you feel like you have nothing to worry about until you have something to worry about. And I think that, again, there are so many women who don't go to the doctor. Thankfully, I was one that went because I needed birth control. But if you think about being able to get birth control over the counter or online where you don't even have to see a doctor, now that is taken away from the women who would have gone to the doctor every year as required in order to get a refill. So now, does that even change the ratio of women that are being checked and could possibly have something detected if they went to the doctor, versus now you're trying to figure out all the things you can do without going to the doctor because you either don't have insurance, or you don't have a doctor you feel comfortable with, or if you do have insurance, you can't afford to go to see a specialist because the co-payment is too much. Like, it's so many things that women do to be able to afford living in the United States, and going to the doctor is always put on a back burner. And I think that is a reason why so many women have breast cancer undetected and they eventually pass away, because there was no one really monitoring their health. And that's a big thing. So even if you don't have insurance or you don't have a doctor, the least you can do is a self-exam. Like, that's the least you can do. And then take it from there. If you do have concerns, then finding a doctor. And if you don't know how to do a breast exam, you can go online. There's plenty of videos online that show you how to do a breast exam and what to look for, and things that you should be mindful of. Because again, if you're able to detect it, then the likelihood of you being successful with treatment is higher. And that's the biggest thing. Like, women shouldn't be dying from breast cancer. And it's unfortunate that so many women do. And with 1 in 8 women in the United States developing breast cancer in their lifetime, like, that's a lot of women. That's a lot of women. So again, you definitely want to make sure you're doing breast exams, and making sure, if you don't feel like you're able to advocate for yourself when you go to the doctor, have somebody with you. Like, my cousin, I tell her all the time, like, when you go to the doctor, if you need to call me because you're not understanding what they're saying, or you need me to explain what I know and what they should be doing, like, call me. Like, put me on speaker and I'll talk to the doctor. And she's done that. Like, it's time she's called and put me on speakerphone, and I would have a conversation with the doctor, because again, she felt like they're not listening. She's not really sure how to explain the concerns, or it's like repeated concerns. So they're just like, oh, well, we addressed that. And it's just like, yeah. And like I said, at the end of it all, she had to just find another doctor that was willing to listen. And now she is being monitored and doing everything that she needs to do to keep that under wraps. But if you are diagnosed with breast cancer, it doesn't necessarily mean you have to have a mastectomy. It doesn't mean you have to have chemotherapy. It all depends on the stage. And there are plenty of treatment options. So I would definitely recommend making sure you have a conversation with your providers. Look into any information a doctor talks to you about that you may not completely understand, because you don't want to just agree to any plan without doing your due diligence to finding out more information about what that means for you and the pros and the cons. Because not every option is the best option for everybody. So you want to do that. You want to make sure that you have a support system, if you're able to have a support system. When I was originally diagnosed, I had a nurse navigator who was there as an emotional support, as a person with all of the information that was needed. And the first thing she said is, once you get home and you around your family, call me and I will answer all of the questions that everybody has, because you're probably not in a mind space to think about everything, but I'm sure your family will have a lot of questions and concerns. And that's what we did. And thankfully, I have Nurse Dika on my support panel. And then it's a matter of research, like getting the information that you need, and having a team that's not going to say, this is what you need to do. If you don't want to do that, then I can't treat you, because this is what I want you to do. Like, that's not how the conversation should go. It should be a conversation about what's recommended, what have worked, what they feel would be the best plan for you. But you have to decide, not the doctors. You have to be the one that make that decision. whatever decision you make, it is going to be a difficult decision. I decided to have a double mastectomy. So I had both my boobs removed. I also had my fallopian tubes and ovaries removed because I know that I'm at higher risk of ovarian cancer and I don't want to have to deal with that down the line. Thankfully, they do implants. So I have implants, but not everybody chooses to have implants if they have a mastectomy. Like you see so many women celebrating breast cancer awareness, going on walks, women without their shirts on because they had double mastectomies. They may have pretty tattoos and things like that, but everybody's journey is different. You got to figure out what's best for you because not everybody's plan is going to be the same. But I do recommend not being that person that chooses to ignore a diagnosis. Because the longer you wait, the more likely it's going to get worse. It can potentially spread. Like, you can't be so in your head that you're just not doing anything. Like, it's not going to be easy, but it's not a forever thing.
Mm-hmm.
There's light at the end of the tunnel, even when treatment is hard.
Mm-hmm.
So, yeah, I think that's important. So, any advice you ladies would give to people when it comes to early detection, the importance of health, supporting a loved one?
I feel like as a healthcare administrator by trade, especially considering the times that we're in, knowing about what programs are available in your state is really important. So currently, barring that there are no changes in New York State, we have a cancer services program that helps you get routine breast exams as well as other cancer screenings, and that's like the routine as well as if there is a history of any sort. So like my understanding is it's a history because you have a relative, or it's a history because you got a blood test that shows that you are you have a disposition to have X, Y, and Z. All states call it something different.
They have plenty of foundations and organizations that are specific for breast, some for ovarian, others for specific cancers, and then the big one for the just cancer foundation.
Yeah, they one of them, yeah, is a National Comprehensive Cancer Network. Is NCCN. And they have like a list of all the different cancers, and it tells you about risk, the treatment options, some of the signs and symptoms of that condition. So it's a whole list of different things, and you can look it up. It's an app that you can actually download.
What's the name of the app again? So like Zika
It's
also, she's our, I used to call her
Nurse navigator.
but she's my doctor.
look. I don't know
Her and
why
my
y'all think
actual
that,
doctor in
because there are
partnership.
so many different nursing areas, and I am not a professional. When you guys ask me questions, I have to go and research myself.
But so
Yeah.
here's the
I
difference,
can
right?
answer
You have
anything
the
about
training
dialysis. Tell me
to
what you
know
need.
what to look for. That's
Yeah,
the
yeah,
difference. Your
yeah,
Google
Exactly.
search on Google University is different than mine.
yeah, yeah.
Yeah.
So,
And before you continue, you were my chat GPT for lab results. Anytime I had to get labs before treatment, I would send it
yeah,
to her. Like, why? Like, what is this?
yeah. Which labs is something that I do. Those are standards. So you can bring me your lab results. I'll look at them and tell you what's going on. But or not what's going on, but what's possible. But it's called, the app though is it's the National Comprehensive Cancer Network. So it's NCCN. And like I said, they have a whole list of different types of cancer and things to look for, and treatment options and stuff like that. So that app is a good app to have, and to look up anything, research anything that you or a loved one may be going through. So I would say too, advice as far as doctors and everything, I would say, because I know that I'm one to get, once I have a doctor that I stick with for a long time, I usually
Mhm.
stick with them.
Yeah.
But if they, just like nurses, there's different areas that they can, cover. You have the heart doctor, you might have
Mhm.
a lung doctor, different specialties. And so it's good to always get a second opinion. And again, I know sometimes the co-payments are, an issue, but if you don't feel like your doctor is hearing what you're saying or understanding where you're coming from, always get a second opinion, because they're humans too. They mess up too. And so, it's best to get another opinion if you're not feeling like you're being heard. And
Mhm.
as far as like support, some people don't like to tell family when they are going through something. And so, sometimes it's okay in the beginning while you're processing everything, but it's something that you don't want to have to deal with on your own. So even if you don't want to tell a family, get in a support group. Like, you would be amazed to know that you're not alone. There's a lot of people
Mhm.
that go through the same thing, and they're all dealing with it, and that can be something to get help to get you through. But you know support
Yeah.
is definitely important.
Yeah, definitely agree with the support or getting connected with the support group. And then
Mhm.
also, like you said, with the doctors and their different specialties. So the doctor that I worked with throughout my treatment is no longer at the practice. So I had to go to a different doctor, which I was not happy with, for the monitoring part. She was with me throughout the entire treatment, surgeries, and everything like that. So the doctor that I have now is a breast specialist, whereas the doctor that I had before was the person that I saw for just the exam. She did the surgery, like she did everything. So breast specialists don't do surgery. So anytime I have issues with whether I'm having complications with the implants or any concerns that may require surgery, I have to see a breast surgeon. And I recently reached out to the breast specialist because I had a concern, and she wasn't able to see me for 2 months. And the practice that she's in have other doctors, but the doctor they scheduled me appointment with was specialized in gerontology. So I'm just like I don't want to see, like, I understand y'all are all in the same practice, but if I can't be with a provider that's able to address concerns within a reasonable amount of time, knowing that recurrence rate is higher within first 5 years, knowing
Mhm.
that the type of cancer, breast cancer that I have was very aggressive, like I'm not waiting 2 months to be seen.
Right.
So I did have to go to another provider where they're all of their doctors are specialties in breast. It's one breast center. And
Mhm.
again, those are choices and decisions that you have to make. Like, yes, I like the doctor when I met her. However, if you're that booked and that busy, then I'm going to need to be with a doctor that's going to be able to address my concerns when my concerns arise. And when I reached out to the other practice, they were able to get me in 2 days. So again, you got to make sure you're with a team that you're comfortable with and not being afraid to make changes if it doesn't benefit you to stay with them. And sometimes it's a headache having to get connected with a new doctor and tell them your whole history and things
Mhm.
like that. But again, you want to be with someone who's able to be more attentive to your needs and not where they're so busy you can't get in when your concerns are there. So that is important. And I wasn't cool with seeing a gerontologist like that. Like,
So I had to
doctor or
look it
no
up because
doctor,
I
like,
wanted to go ahead and make sure that I wasn't bugging. So that is a geriatric
It
yeah,
is.
provider,
It is.
correct?
yeah.
Yes.
So geriatric
Specializes.
Yeah.
Yes, so
in
specializes
aging.
in working with older,
Yeah. Yeah.
senior, elderly. Like, yeah. And I don't know. It didn't sit well with me. Like, and I originally scheduled the appointment, but I'm just like,
I don't
when
even
I'm
understand how
just
they come up with that. Well, the breast specialist, she can't see you for 2 months, but we could send you to the gerontologist.
yeah. And it's one practice with
Mm-hmm.
multiple doctors, but they
Yeah.
all have different specialties.
Mm-hmm.
So again, if I'm dealing with breast issues, I want to see a breast specialist. When
Yeah.
I get old, I might schedule an appointment with the other lady. But at this moment, like, I need somebody who knows their breasts. I
Yeah.
need somebody who knows, like, and have
Yeah.
experience. Like, yeah, like, yeah. So that didn't work for me. So definitely, again, making changes when you need to make changes. There's nothing wrong with that. Like at the end of the day, like you're paying for the care you're receiving. So don't feel guilty if you gotta find another doctor. Sure, they'll find another patient to fit your slot. That you want to be with someone who like you feel
Long
like
as we
okay
keep
after an
living,
appointment.
we'll be a patient.
Say it
Yeah.
again.
As long as we keep living, we'll be a patient of some
Exactly.
sort.
Yeah.
Exactly.
Mm-hmm.
So that's definitely important. I enjoyed that conversation. And Sadiqa, you better start checking your boobs more often. Stop playing. Check your boobs.